And so for me, so I am a family physician. I've been practicing in Hamilton, and I also work in our four acute care hospitals in Hamilton. And so, a year ago, I hadn't ever considered a political office. But I, like you, saw the crisis that we were seeing in healthcare. I saw more and more patients lining the hallways. I saw longer wait times in the emerge, and I saw more and more of my patients having their healthcare needs go unmet, despite the fact that we had solutions to be able to fix the system that we have. And so I decided to run for the Ontario NDP, and I'm so glad I did because this has never felt more important, particularly at this time when we see threats to privatization, not only in Ontario, but across Canada. And I'm delighted to join with you today to stand in opposition to those threats of privatization and to fight to protect the public healthcare system that uplifts us all. And I know I don't have to tell anyone in this room about the benefits of public health care and the harms of privatization. You know it, and we've seen it over 2 decades of successive conservative and liberal governments who have not only kicked open the door to privatization, but are trying now to make it normal, and it's not. And we know from the example that Marit brought forward about long-term care how harmful it can be and how privatization actively does cost lives. And we also know that it's just not an effective solution. And we're seeing that right now with the Conservatives introducing private for-profit clinics as the option to try to solve our surgical backlogs. And OHC has been at the forefront of this with the bungled cataract surgeries that have been outsourced to for-profit clinics. And now we're seeing patients upsold, charge thousands of dollars in extra fees. And the real pain of it is that we were told that that outsourcing to for-profit clinics was going to shorten wait times for cataract surgery. And all we have seen is that the cataract surgery wait times remain the same for everybody except those who are wealthy. And that's exactly what OHC and others who promote our public health system have said all along, which is that privatization will only benefit the wealthy among us, and everyone else will see further disparities in care. And so, where do we go from here? So first, as Marit has said, and as France and I are completely committed to, the Ontario NDP stands behind public healthcare 100%. We are uncompromising in that that is the way that our healthcare system needs to continue to go. But in order to be successful in protecting our public system, we have to do a number of things with our advocacy and with our action. It's not going to be one approach only. And in order to be successful, as many have said, we must not only defend our public healthcare system as it is, but we have to restore it and we have to expand it in Ontario. We have to start by defending it by ensuring that the federal Liberal government actually enforces the Canada Health Act, not only here, but in Alberta as well. And we need to send a message to Conservative provincial governments across Canada that they cannot dismantle public health care and go unchecked. And I know that OHC is leading this, and I thank you for leading this pressure on the federal government to enforce the Canada Health Act. We need that. That is a huge part of our defense. But in order to get widespread public support, we need to also restore our public health system and then expand it. Because for every one person who understands the risks of privatization, there are 50 more who have had a negative healthcare experience recently and are desperate for solutions for themselves and for their families. And we know that this is part of the Conservative strategy. Defund to the point of dysfunction, make everyday people feel that pain in the emergency department, in the hospitals, in trying to find a primary care provider. And then, when people are feeling desperate, introduce privatization as the only answer. But the thing is that there are solutions for the current crisis that we face in healthcare, and those are public solutions. And we need to demonstrate to the public that those solutions not only exist, but that the Ford government is withholding implementing them in order to further its strategy. And so for every person who says that they're spending 18 hours in the emergency department or that they've cared for their family member for days in a hallway stretcher waiting for an inpatient bed, we need to talk about the cuts to hospital funding and how our inpatient units have been starved, how we've never had enough inpatient beds, and that it's possible to expand inpatient bed capacity so patients can go to the emergency department, be seen, be admitted, and swiftly move up to a care bed where they are able to be cared for in an appropriate setting. That solution is available to us. Ford knows about it and he just won't implement it. And so we know that their solutions are there, and that's how we have to restore our system. We have to make it feel like something worth fighting for again. And beyond restoring, we also need to expand. People want to be able to imagine a better healthcare system. We want to be able to imagine a system where gaps are filled. And that's where you're going to be hearing from us about expanding universal pharmacare, about head to toe healthcare, including universal mental health care. That is what we are willing to do. And I'll just close by saying that I've recently been reading a lot about Tommy Douglas and his fight for Medicare. And one quote from the historian said something that really stuck with me, which is that Tommy Douglas, as much as he is renowned as our hero for Medicare, he was essential, but he was not sufficient to realize the dream of Medicare. There is no one person, no one leader who can defend and restore public health care. It has to be all of us. And that is why I'm so proud to stand with you today. I'm so proud of the work that our Ontario NDP caucus is going to be doing. And I look forward to continuing that work alongside you as we move forward. Thank you very much.